The information provided in the Golden Nuggets health and wellness shows, including but not limited to advice, tips, and discussions on mental, physical, and spiritual well-being, is intended for general information purposes only. It is not a substitute for professional advice or treatment. The Golden Nuggets health and wellness shows are designed to inspire and inform, promoting a holistic approach to health for the mind, body, and soul. However, individual circumstances vary, and what works for one person may not be suitable for another. Before making any significant changes to your lifestyle, diet, exercise routine, or adopting new practices discussed on the show, it is strongly recommended that you consult with qualified healthcare professionals, nutritionists, or other relevant experts. They can provide personalized advice based on your specific needs, health status, and any existing medical conditions. The host, guest, and producers of the Golden Nuggets health and wellness shows do not assume responsibility for any consequences arising from the use or misuse of the information provided. Viewers and listeners are encouraged to use their discretion and take responsibility for their own health choices. By engaging with the Golden Nuggets health and wellness shows, you acknowledge that the content is not a substitute for professional advice and that you will seek the guidance of qualified professionals when needed. Thank you for being a part of the health and wellness community.
Welcome to the Golden Nuggets Health and Wellness Show, a television program that's redefining self-care for the mind, body, and soul. My name is Dr. Elect Starr. I'm a licensed mental health counselor, a health and wellness consultant, and your host for this show. Our mission is simple: to empower you with creative and innovative self-care strategies that help you prosper and be in good health, even as your soul prospers. Our first series, entitled Compassion Fatigue, The Cost of Caring, we dive into the emotional and physical exhaustion experienced by helping professionals. We explore what compassion fatigue is, who's at risk, its signs and symptoms, and most importantly, the steps to address and prevent it. And that's what we're going to focus on today. How do we prevent and address compassion fatigue? But before we begin, let me introduce you to our guests, Indya Peoples Simpson and Dr. Anthony Walton. We're so glad to have you back with us.
Thank you for having us.
Yes, enjoy having you, and honored to even know you. So before we begin, say a little bit about yourselves.
You go.
All right, I'm Anthony Walton. I work as a marriage and family therapist. I'm also an author. I've been blessed to write 12 books. A lot of those books are books I've written out of my own personal experience. I did bring a few of the books here with me.
Oh, great.
I have about 3 books that I've written that really have impacted my life. You don't mind if I show this? This is one called it's called The Empty Quiver: A Journey from the Pain and Despair of Loss to Recovery, Hope, and Victory. I use this in grief counseling. I've had a lot of clients that have experienced a lot of loss.
I have that book.
Oh, you had that one? Mm-hmm. All right, thank you, good. And the second one, this one has impacted me personally. God gave me the title. It's called The God of Increase. And ever since I wrote How to Tap into God's Hidden Treasure, ever since I've written this book right here, it has affected me to, it's like every day God's just opening doors. So I think it feels good. This one book, this right here, is Why Can't We Get Along? A lot of people use this right here. And this one, I think I'll stop with this one right here. Well, the worth of a woman, do you know your value? I deal with a lot of female clients that are highly intelligent, highly motivated, but somehow they have not recognized their true value. And sometimes we allow people to diminish us, our self-value of ourselves. And so I write this to help women not do that. I guess I might as well, this is the last one right here. The I, the Believer, deals with our personal self-concept, how we view life. I had 3 eye surgeries, so I deal with the natural eye compared to the spiritual eye, and God just gave me that revelation. I think I'll just stop it there. If some of these are on Amazon, my email, you can reach me through email if you want further information on how to get those books.
Thank you so much.
Thank you for sharing.
India.
And I'm Indya Peoples Simpson, and I have a group practice. Healing and Hope Restored is the name of my practice. And I have 3 clinicians that work with me. And
Awesome.
also I see, I do some contractual work with other agencies to provide their providers with clinical supervision. So I also, at Healing and Hope Restored, we also have interns that we help professionally develop. So
That is wonderful. Well, again, thank you for joining us today. And we talked about in our previous segment what compassion fatigue was. We described it in detail, we defined it, and we talked about who's at risk. We talked about signs, symptoms in our previous segment. And today we're going to address the steps to how do we address it? How do we prevent compassion fatigue? And so I'd like to begin talking about this thing called self-care. Self-care. Why is self-care important? You know, sometimes people get self-care confused with self-help
right.
or self-indulgence. So before I share some of the benefits, I'd like to hear from the professionals, the licensed clinical social worker, and the marriage and family therapist. What's this big deal about self-care? Why is it important? Why are we talking about it today?
Well, why we're talking about it today is, and why it's so important for our profession, is because of what we're talking about today, compassion fatigue. I mean, being able to be empathetic and hold the things that people bring to us can be very traumatic. And so that's why self-care is so very important. It's because we are the holders. It's like we're the vault of all the secrets, all the hurts, all the wounds. We're holding these things for people. And so that for sure is why self-care is so important.
Wow, I never heard it described as a vault.
Yeah.
Wow.
Like that.
Dr. Walton.
You know, some years ago I was in Nigeria, West Africa, and I had a pastor tell me, he said, if you kill the horse, then the messenger cannot carry the message. And so we have to realize that as gifted, as talented we are, as much as we've invested in ourselves, if we kill ourselves or allow ourselves to become sick, we'll not be of any value to anyone. Sure. And so that's why self-care is so we can continue to perform at our peak capacity. And that's why I think it's important.
All right, thank you. So just a few things that I'd like to share with our viewing audience about self-care, the benefits. So first of all, self-care refers to the practice. It's a practice of taking deliberate actions to maintain and improve your physical, mental, and emotional well-being. And oftentimes I tell my clients, you have to be intentional about this.
True, so true.
And when I say intentional, I mean consistent. There has to be a plan. And then I always give them that saying, if you fail to plan, and I'll go, what's the rest of that? And sometimes they'll go, I don't know. So I go, if you fail to plan, then you plan to fail. And they go, oh. So you have to have a plan.
For sure.
So there are numerous benefits to incorporating self-care into our daily routine. And these benefits can have a positive impact on various aspects of our lives. So here are just some key benefits of self-care. Improved physical health. Enhanced mental health. Now, before I go any further, elaborate from your personal experience the improved physical health and the enhanced mental health. Dr. Walton, let's let you go first this time.
I think when you take care of your body, as I just recently started working out here, and
just recently, huh?
Recently,
well,
it's
like better late than never.
It's like you said, you have to be consistent. I've hit and missed.
Absolutely.
But I realized, recently I've gotten back on it, and you have more energy. you feel better about yourself. And when you feel better about yourself, you feel better about what you do.
For sure.
And so I think when you invest in yourself, and you're at your best performance, then your clients, they become the recipients of that. And so
Absolutely.
I can tell the difference. Yeah.
Absolutely. Enhanced mental health. Can you speak to how your mental health is enhanced? I know you spoke physically, being in the gym, right? Not that it doesn't affect you mentally, but can you be more specific in terms of sharing how you enhance your mental health to reduce or minimize the risk of compassion fatigue?
That's a very good question. I think one of the things is getting plenty of rest. Rest allows my mind to refresher, and then focus on positive things, investing in myself. I like to play a good game of chess every now and then, kind of helps my mind to become sharp. I like to go to the gym. Not only the gym, I like to just go, as we spoke earlier, the last segment, I like to go traveling, sometimes just get away, just sometimes sit on the beach and just sit back and relax.
That sounds wonderful.
And enjoy nature. I'm kind of feeling like I need to be going somewhere right about now. That sounds good. But all those things, anything you invest in yourself, it helps you. And so sometimes I will say this right here, many times I've dealt with clients in the past, and I begin to start telling them a litany of things they should do, and I start thinking,
Wait a minute.
am I doing those things? And then I have to be honest with myself. There have been times when I wasn't doing those things, and I had to just go back and say, I need to correct those, because if it's good for them, it's good for myself as well.
Sure.
Absolutely. And I was just thinking perhaps we should kind of review what compassion fatigue is for those that perhaps missed the first segment, where we went in detail and we talked about it. So compassion fatigue, what is that? So it's this gradual decrease in compassion for yourself and for others, and it happens over a period of a time, and it has this profound emotional and psychological, physical exhaustion. You're worn out, you're drained, mentally, physically, emotionally, and it just happens over a course of time as you're caring for people who are suffering. And then it has these impacts. It can affect your productivity,
Right.
cause absenteeism, inability to focus, and then there are these new feelings of incompetency and self-doubt. So just wanted to kind of review that as we are exploring now, what are the benefits of self-care and how can we reduce these symptoms? How can we minimize them? Now, do you think that you can do this work without feeling no compassion fatigue? Absolutely zero. Indya?
I don't think so. I think that I mean, I'm envisioning a bucket that has water in it. If someone's constantly putting water in it, at some point, it's going to be full. And I think that full point, the visualization of that is the compassion fatigue point. And so there has to be an emptying out. There has to be a rejuvenation. There has to be a time when you can start again, refresh, renew.
Absolutely, thank you. Dr. Walton, we have a few minutes left. Any thoughts on, can we do this work? What are your thoughts on that without having zero compassion fatigue?
I think the only person who can do it with zero compassion fatigue is someone who is not empathetic. And you cannot be effective if you lack the ability to be empathetic to other people.
Wow.
So the mere fact that you're empathetic means that you're able to feel people. And sometimes you almost like you feel those emotions that the person, almost like they're transferring. It's almost like they're transferring their emotions onto you. And so you have to know how to take it, how to release it, and not hold it on yourself. And when you don't understand or allow yourself to be able to release it some kind of way, and that's when the fatigue starts getting, because your love for people is mainly what causes the fatigue to build up. And then we understand our limitations. Sometimes we want to help everybody, and we realize we just can't help everybody. There's some situations you want to help them, you give them your best everything, and it's just not good enough, and then it's
Excellent, thank you. Well, we're going to pause for a break, and we'll come back and we'll continue this discussion of the benefits of self-care.
Dr. Starr, best-selling author of Golden Nuggets, Food for the Mind, Body, and Soul, is also a health and wellness speaker and consultant who provides motivational speaking, training conferences, and one-on-one coaching to improve the quality of life. She's passionate about helping people heal from the inside out. Dr. Starr provides creative and innovative self-care strategies that empower you to prosper and be in good health, even as your soul prospers. Call or visit the Golden Nuggets website today. Feeling anxious? Perhaps you're dealing with a past trauma and don't know where to turn for help. Turn to Unlimited Possibilities. We provide a safe and caring space for individuals and families to help improve the quality of their lives. Whether you need help with spiritual matters, trauma, depression, and more, Unlimited Possibilities can help you overcome your situation with compassion, acceptance, respect, and empowerment. Unlimited Possibilities, where all things are possible if you believe. Call or visit our website today.
And welcome back to Golden Nuggets. We're so glad to have you, and we're just going to continue our discussion on the benefits of self-care. And we're glad again to have our wonderful guests and friends with us, Indya, Anthony, and I know you're Doctor, but today you're Anthony because you're a friend. But we're just glad to have you, Dr. Walton, seriously. So let's continue this discussion. We said that one of the benefits of self-care is enhanced mental health and improved, number 2, physical health. So Indya, in your role as a clinical social worker, and the work that you're doing, the awesome work, I might add, that you're doing, can you speak to that? How do you improve your mental health and enhance your mental health, and why is that important in doing the work that you do?
You know, on some days it's all about me and all about my personal self-care plan. And on other days, it's about how I'm able to give to not my clients, but how I'm able to give to these future me's that will be out into the world. The interns that I work with, like I shared with you the last time we were here, that one of the things that I really try to do a better job of is being the kind of a supervisor that I needed. And so I do really spend a lot of time preparing them for compassion fatigue and what's that going to look like, and what you know, the risk factors, but then also how we can offset that.
I think it's beautiful that you've taken your experience, your personal experience, what you didn't get, and you're being intentional about making sure that the folks that you supervise get it. Would you say that's like turning lemons into lemonade?
Kind of, and I'll tell you, you know, when Dr. Walton was talking earlier about energy, I was thinking about that very thing, that, you know, sometimes that is that is the good energy that I get when, and it's a sense of accomplishment. Right. And that certainly speaks to your emotional well-being too. And when I feel like, when I leave that that counseling with the supervisee, and I feel like they have it, or we come up with a self-care plan, I mean, that's rewarding for me. It feeds the reward center of my brain.
Right.
That's awesome. And I want to remind our listening viewers that we're talking about compassion fatigue because many of those in the helping field are at risk for this phenomenon. And so it's important to know what those signs and symptoms are, to understand compassion fatigue, first of all, to recognize those signs and symptoms. Who are the people at risk? So I just want to review that. Yeah. I know we talked about it in our previous show, but so we're talking about people in the helping field. They are the ones who are profoundly affected by compassion fatigue. And so you have those that have direct exposure to trauma, which would be the firefighters, the paramedics, the policemen. These folks have direct exposure. They are seeing it firsthand. That puts them at high risk for compassion fatigue. Would you agree?
For sure.
And then you have that group that experiences secondary exposure. So these are the nurses, these are the doctors, mental health therapists as yourself, social workers, caregivers, clergy's wives. Sometimes we forget the clergy wives,
Right,
but
for sure.
they're also supporting hurting people. Foster parents, and even parents, and grandparents, by the way. You know, sometimes we forget grandparents are taking care of traumatized grandchildren.
Right.
So all of these folks are at risk. And so I think it's so important that we focus on a self-care plan. So what does that look like? But before we even get into the details of specific things you can do, I want to make sure that we understand what are the benefits. Why do I have to do it? Why is it necessary? So work-life balance, enhance relationships. Those are benefits
True.
of a good self-care plan. Who would like to address that?
Well, when you said work-life balance,
I saw you smile.
I talk about this a lot in my sessions with people because I feel like that can't be. Because when I think of a balance, I'm thinking that there are equal amounts of energy or equal amounts of whatever that's put into this thing that makes it balanced. And we all know, especially as mothers, as pastors, you know, there's going to be times when you have to give more to one side than the other. And so that's why I smiled, because I'm like, oh, is that really a thing, work-life balance? But I understand what you're saying, and there has to be a balance. And I spoke about this before, about how our work, our title cannot be our only identity. We have to
Absolutely.
have other outlets, other interests, other things other than going to work, coming home, cooking dinner, going to bed, going to work, you know, the rumination.
Absolutely. Dr. Walton, what are your thoughts on the benefits?
I agree with what Indy was saying. So I think you have to say, what is your goal, your personal goal? What is it that I want out of life? Because sometimes we are driven and we don't realize that the end does not justify the means, or the means doesn't justify the end. So we have to focus on living in the moment. And so sometimes we're focused on the future, that we don't take time to prepare ourselves mentally, physically, emotionally for today. And so other parts of our life suffer because we're not focusing on our own personal self-care, because all we have in mind is just that end goal. I want to do this, and eventually I'm going to do this. So I've learned to live life in the moment, one day at a time. So I may not be able to get that yacht, but I'm going to go on a little boat ride today.
All right.
And I'm going to just go ahead and enjoy time as I can. And I think when we do that and we learn how to operate in the moment and just enjoy ourselves, then we have a better quality of life and we're able to help others. And so one other thing I would say, some pastors and we used to get together. We said no title. We just get together and play pool. We just fellows together, and we just enjoy ourselves. And we have to learn how to laugh. I learned how to laugh,
Absolutely.
enjoy
That's
myself, and not allow a lot of things to get to me.
For sure.
Absolutely. I like that. Laughter. Laughter is like medicine, isn't it?
It is.
Absolutely. And I can't wait, for us to get to that piece where we start exploring all of the self-care strategies.
Right.
Just put them out there in the universe and let people grab them, That works for me. Yeah, I like that one. I'll do that one. Other benefits is reduced stress, personal growth. Personal growth, reduced stress life, long-term well-being. What are your thoughts? You agree with that? You have anything to add to those benefits? These are wonderful benefits.
They are.
Again, we're talking improved physical health, enhanced mental health, increased productivity. Who doesn't want that, right?
Right.
Now, you must be doing well. How many books you wrote? That's productivity for real. Work-life balance, increased creativity. That's another one. Your brain, has the space to create, right?
Right.
De-stressed, personal growth, and long-term well-being. Aren't those wonderful benefits? of self-care? Who wouldn't want to practice self-care, just understanding these are the
Right.
benefits of it?
Right.
And your thoughts on these benefits, they're wonderful. It's important to note that self-care is personal
Yeah.
and it's individualized, but here are the benefits.
Right.
Thoughts? I see your brain kind of turning, India.
Yeah, I was just thinking that, you know, as you were talking about those benefits, that, I mean, back to like just feeling, you feel good when you are
Absolutely.
productive. You feel good when you're meeting the goals that you've set for yourself. That enhances your abilities, your, like you said, your creativity. Just, you feel good.
I agree. Dr. Walton, any thoughts you want to add before we move into various strategies?
I think it's important to set goals that are measurable, goals that are achievable. Sometimes we set goals that are so far to reach that creates stress in our lives to do.
Absolutely.
So I minimize, you know, I take, you know, a little goal at a time, little steps, baby steps, until I can, you know, fulfill what my ultimate goal is.
I agree, and I'm glad you mentioned that you can set standards that are too high, that make it stressful. Absolutely. So I want to just kind of talk about some strategies now. These are the nuggets, right? The nuggets, specifically for therapists. And so let's begin. I have 16.
Okay.
So let's start with self-awareness.
Good.
And reflection. Healthy work-life balance, India. Supervision, consultation. These are all nuggets, things that you can incorporate into your daily plan. Social support, regular exercise, healthy eating, sleep hygiene, mindfulness, and self-compassion. That's a whole nother segment right there, self-compassion.
Yeah.
Time management.
Big one.
Aren't these good nuggets?
Very good.
Supplemental support. Continued education and training, a must. Would you agree?
Definitely.
Maintain personal interests, boundaries, and ethics. Regularly reassess your self-care plan and seek help when necessary.
Yeah.
Yes.
Now, we know that every plan is individual, right? But I think these are good things to consider. What are your thoughts as we wrap it up, talking about compassion fatigue and how we can minimize those risks to continue to help people, pour into people? You know, as India so clearly said, you know, if you just keep pouring and keep pouring and keep pouring, it's just going to run over. And if I keep pouring, it's going to run off the table and onto the floor.
Right.
At some point, right, you have to stop, refresh, restore. So as we come to the end of this program, what are your final thoughts on a self-care plan? What would you recommend today?
I really like what you said. I think you covered it very well. I think
Thank
you know
you.
self-awareness is one of the main things. You just, you know, to their own self be true. And so one of the things I've learned to listen, not to listen to what your client's saying, but listen to your body, how your body's feeling, your mind, what your mind is saying, and just
Very
listen.
good.
And as you listen to yourself and have a self-awareness of what's going on, then you can make those adjustments, necessary adjustments that have to be made in your life.
Good. India, you got 2 seconds.
Well, boundaries. Boundaries.
Boundaries,
Say no.
boundaries.
Say no.
I agree. And thank you again for being with us today. This has been wonderful. I hope you enjoyed it as much as I did.
Oh,
and
yeah.
I know that our audience enjoyed it. So thank you all for joining us. Goodbye now.